Hi, this is Dr. Wells with Wells Medicine. Ketamine doesn't work like a traditional antidepressant. Traditional antidepressants are based on the neurotransmitter theory of having more serotonin, more norepinephrine, more dopamine running between the neurons in the brain and sending their signals between the neurons in the brain. So you have different classes of medications like serotonin reuptake inhibitors, SSRIs, like Prozac, Paxil. You have SNRIs, selective norepinephrine reuptake inhibitors. Those increase the levels of serotonin, norepinephrine in the fluid around the neurons in the brain, sending more and more signals back and forth. Ketamine actually, we believe it works through increasing something called brain-derived neurotrophic growth factor, which increases the growth of neurons and neural connections, which is like having more post offices to send and receive the neurotransmitter letters in between. So ketamine works in a very different way than SSRIs and SNRIs. And that's also why we think it works faster. Within 2 or 3 appointments, 70-80% of patients will notice about a 50% decrease in their depression symptoms versus an SSRI or SNRI, which can take up to 6 weeks to really start working. The BDNF and increased neural growth is also why ketamine seems to have more flexibility, more resilience as part of it, versus the SSRIs, which just describe sort of having a lifting of the depression symptoms. A lot of patients will ask us, why isn't there anything on there about happiness? And I feel so much happier as opposed to blunted or numbed, which is often what patients are describing with SSRIs and SNRIs. But ketamine works differently, and so that increase in happiness can be also from the new neural connections and the flexibility and resilience getting unstuck. So ketamine works very differently than the typical antidepressants.